Now, hi everyone. We're live on Facebook. I'm Kim Martino Sexton. Welcome to our Heartland PMAD Facebook Live. I'm here with my business partner, Elizabeth Lauder, and Erin Poniewaz from the Mercy Mother Baby Intensive Outpatient Program. And we're here to learn more about what's been going on with the Mercy Mother Baby Intensive Outpatient Program. And so Erin, we'll just jump right in and get started. So tell us a little bit about what the Mother Baby program is. And then of course we want to hear about the changes that have occurred since quarantine.
Yeah.
Welcome.
Well, thanks very much, you guys, for the invitation. So happy to be a part of this and to spread the word about what we're doing. So the Mercy Mother Baby Intensive Outpatient Program is an intermediate level of care. And so basically what that means in a nutshell is if you think of an inpatient admission as sort of most restrictive and outpatient, seeing a doc once a month and a therapist once a week as least restrictive, we're kind of right in the middle of that. Mm-hmm. So it is a fairly intensive, quite a commitment for moms. Normally when we're working face-to-face, moms come to group 3 days a week for about 3.5 hours a day. And we meet here in an outpatient building. And if mom has baby that is 12 months or younger, she's welcome to bring baby with her. We've got a small nursery on site where just basic childcare is provided by volunteers that are wonderful. Mom still assumes total care and custody of baby while she's in the program, but we're here to provide whatever support she needs. So,
and that's a significant, I'm sorry to interrupt you, Erin, but I think that's really key. That's what we did not have here in St. Louis until the Mother Baby Intensive Outpatient Program opened. There's other intensive outpatient programs, but a couple things that are really significant and so important. One, it's mother focused, hence Mother Baby. And then two, that you get to bring your baby who's 12 months and under. And I think that is a game changer, something that we needed for so long. So just wanted to make sure that we highlight, like, because people are like, oh, so you just have this thing. No, this is huge.
Well, and that was one of the barriers that we identified right away. Transportation was another one, which with the virtual world, that might eliminate some of that, hopefully moving forward. But certainly wanting moms to feel encouraged to bring baby, especially for those struggling to bond with attachment issues, being able to, for me to be able to see that, to see that relationship and that interaction has been so helpful. And obviously childcare is a huge issue. So, so having the nursery on site's been lovely. I think it's really underutilized, but it's nice to have that support there. The babies usually just tend to hang with us for the majority of session, unless of course mom needs a break or whatever the case may be. So yeah, that's been great. I had moms showing up face-to-face up until the very end of March. And then April 1, we transitioned to the virtual platform, which has been an adjustment, probably more so for me than the mamas. I think I'm older and more old school. And I want to feel your energy, and I want to see your eyeballs and read your body language. And some of that is limited, as you guys know, in the virtual world. And just wanting to maintain the support for those that are sharing, while also trying to check in with everybody else and make sure that they're getting their needs met. It's just a very different platform. So we are adjusting.
Making it work.
We are. I anticipated, Kim, we were talking about this. I anticipated that we were going to be flooded, just inundated with admissions, that I was just anticipating being completely overwhelmed and not able to keep up with mamas. However, I think there's something to be said for the resiliency of these mamas. And certainly the group that transitioned from face-to-face to virtual with me, man, they rose up and they handled it. And it was very powerful to watch. just to see them do that with such grace and to kind of pull it together and take care of themselves, take care of their babies, take care of their families. It was very cool to be a part of that. So, you know, I think our numbers are starting to increase a little bit. I think the needs of the moms and the issues they're bringing to group look and feel a little bit different than what they had pre-COVID. And so, I would like to hear certainly from you guys about some of that too, and you know what your folks are bringing.
Yeah, what have you noticed the things, the trends that moms are experiencing now that they've been home with their kiddos for over 2 months?
Yeah, I kind of wrote a bunch of things down, like just stuff that just keeps coming up. Obviously, they were already feeling isolated, so many of them. And so what this isolation looks like now, there's a difference between I'm isolating because I'm home taking care of a newborn, and being forced to stay at home, being told I can't access those supports that I would have otherwise. So that's been a big conversation. The lack of support that mom was counting on that now she doesn't have access to because of the stay-at-home order. A lot of discussion about getting creative with self-care. What does self-care look like when you're stuck at home, four walls, and the monotony of the day-to-day? How do we get creative and take care of ourselves so that we can be the moms we want to be for our babies? One of the things that's come up a lot lately is self-care preservation while trying to also support my partner or the rest of my family. That's sort of like cohabitating. Everybody's at home, everybody's in each other's space. It feels very different. I think we are a lot less tolerant maybe. And so how do I take care of my own mental health while watching my partner struggle and try to support them as well? So that's been a big topic of discussion. A lot of safety planning, especially toward the end of the week, going into the weekend. There's not a lot of activities that we can do, but we're trying to focus on what we can do. We can get outside, even if the sun's not shining, we can step outside and get some fresh air. So trying to focus on what's in our control, really, rather than what's not, because so much isn't right now. For me, and I talked to Elizabeth about this last week, the anticipatory grief that I think Dr. McKean touched on a couple of weeks ago, even, that's really been up, not only for myself as a provider, but for a lot of the moms, just that uncertainty of what's to come. What's this going to look like moving forward? I know for the moms, it's fear about, my husband's home now, or my partner's home now, and they're able to pitch in and help and share the load. But what happens when they go back to work and I'm having to do this all over again? So that's a very real fear for them. So these are just some of the conversations that we're having. Yeah.
So what's it been like, for you as a provider to be in a position where it can feel really challenging to support our moms for numerous reasons? It's hard to be in a position where you're, we can't change reality.
Right.
And a lot of the moms that we work with are sharing negative thoughts, but they're also true. So yeah, right. So how do you talk about that with your moms, and how are you dealing with being in that position?
I think stepping into vulnerability.
Yeah. We were
and,
talking about that last week.
And just trying to just be as honest and transparent and real with them, kind of meeting them halfway in terms of, yes, I'm I'm the professional in this environment, but I'm also living it. And so being able to have conversations about sharing some of those fears, and I'm not exempt just because I'm a therapist. I'm in it too. I think kind of helps to normalize some of that for them, or at least I certainly hope it does. And we've shared some intense emotions together as a group, just being all kind of, that empathetic place of fear has been overwhelming at times. And we've shared some real emotion that maybe we wouldn't otherwise have, that I wouldn't have otherwise shared. So I think really just being vulnerable and honest, and I don't have all the answers, but I can hold space for you to work through whatever it is that you need to. And the other moms in the group have been wonderful to hold each other up as well. And if one mom needs more time on a particular day than another, that's just the nature. That's the beauty of groups, I think. Because we don't all need as much support on every day, but there is that space to give it if a mom is struggling on a particular day. So that's been helpful as well.
I find it to be really liberating as a fellow person in the room, but also when you're a facilitator or a therapist, in charge of running a program, when we can say with some integrity, like, I don't have all the answers, and that can be good news. Like it's not my job to know everything.
Right.
That's setting us as helpers up for failure in a way, but just to say, like, I don't know all the things, and we're not going to know all the answers for our clients either. Like, they're walking their own path. But I think what you speak to, Erin, is, and I'm a huge fan, I know you both know this about me, but you're speaking to the sitting with women in their discomfort and pain and grief and uncertainty, and you're just empathizing with them. And I don't mean to say it like it's a small thing, but it's a simple thing, but it's not necessarily an easy thing to sit with someone and we know we can't fix it, but we're also not going anywhere. I think that's huge.
Absolutely. And just that the willingness to, you're not alone in this, and I'm going to walk with you. And it may be an uphill battle, but we're going to do it together, and we're going to come out on the other side. So that feels, I think it feels supportive, not only for the moms, but for me as well. And being able to witness that and be a part of that journey with them.
So do you currently have openings? How do people register for your program if they're interested or know someone who is?
That's, I'm glad that you brought that up. So in the virtual world, there are some restrictions. And so face-to-face, I could have far more in terms of census or capacity than what I'm allowed in the virtual world. So I can have a total of 9 moms, and then with myself, that would be 10 total. That's all that they allow us to have, which I think would feel unmanageable. But we would do it if we needed to. So yes, I have 7, with myself 8. So I do have 1 opening right now, but I also have, potential discharges happening each week. One of the great things about our program is that people are kind of coming and going all the time. So you get to see some moms who just just started. You get to see some who've been here for a while, and you get to see some who are getting ready to discharge or graduate. And so that's really nice.
What's the typical length of the program? And forgive me if you already talked about this while I was setting everything up.
Oh, no. It's really very individualized. I would love to be able to say, like, it's 3 weeks, but that's not realistic.
But that's, but that there's some flexibility based on how folks are presenting and insurance concerns. I'm sure, that there's many things that play a role, but would you say like a typical or average length of participation?
I mean, I would say probably 4 to 6 weeks. Okay. Maybe 4 is probably a little bit on the low end. Okay. 6 to 8 might feel more realistic. And that's 3 days a week, 3.5 hours a day, virtually 3 hours a day. So again, it's quite a commitment. And I know that being at home has its pros, but it, you know, it also has challenges too. And we're trying to protect everyone's confidentiality. I can't control who you have in your home or in the room. You know, so some of those things have to be taken into consideration as well. But I'm doing assessments on days that I'm not running group, but I'm still assessing for all levels of care. You know, so if anybody feels like they want to send a mama that needs an evaluation, or whether for my program or for access to other resources, that is a free service that we provide. And so I'm doing assessments on Tuesdays and Thursdays right now. But if someone was in an immediate, there was an emergent need and I was not available, we certainly have other intake coordinators who can do those assessments. One being my former student who's now an intake coordinator. So she knows the criteria, and because not every sad pregnant woman needs to be an IOP, right? Like that's just, she may not need this level of care, but she might too. And so.
And it's good that and when they call, it's not like if they don't qualify or are eligible for IOP, you say like, oh, sorry, bye. Like you're going to let them know what level of care would be appropriate for them and give them resources. So
absolutely, they're always going to leave with resources for sure. For sure.
What number do they call?
So the intake line to schedule an assessment with moi, or just for the Mother Baby program, is 314-251-6500. Elizabeth, did I give you the wrong number?
I didn't see it on my text, so I was so sorry to make you say it again. But no,
that's okay. I'm just thinking as I said out loud. I'm like, oh, I hope I gave her the right number. So let's do that again. 314-251-6500. If for some reason you're calling after hours, we do have confidential voicemail. Just leave your name and number and say, hey, I want to get hooked up to talk with Erin, you know, have an assessment for the program. And so, and we have access to tons of resources. Everybody's doing such great work right now. You know, my job is to connect mama with whatever she needs to help her be successful. And if it's not my program, maybe I'm sending them to Liz. Maybe, you know, maybe they're calling the mom's line, whatever the case may be. I want every mom to know that they're not going to leave here empty-handed.
And I think, because I think the word intake can be a little scary.
Absolutely.
So I think it's important to kind of, maybe we can spend a moment talking about that, you know, what an intake is, because you're not going through an intake doesn't mean you're obligated to do anything. It's a learning opportunity. And it's gathering of information, right? It's, and everybody kind of, I think, approaches it differently. Sure, I have stuff that Mercy has me do, but I have my own like perinatal screen that I do, you know, that I pulled from my training through PSI. And so making sure that we are asking the right questions, even though they may be the difficult and hard ones, that's how we're going to be able to determine what is, you know, going to best suit your needs. So it's really clinical terms, a psychosocial evaluation, where we're pulling from medical history, family history. And while all of that is important, I appreciate that I have the opportunity to assess a majority of my moms, because I'm going to be working with them, right? But also, I'm at an advantage of being able to have that one-on-one interaction. What is the presenting issue? What's really bringing you here? And what are you hoping to get out of the program? What are your goals for treatment? Those are things we can talk about right out of the gate, which is fantastic. And so it's not this in-depth, you know, did your mom have diabetes? Does your dad have, you know, it's really not. We do a very thorough risk assessment, which is critical for anyone. And so that's been really helpful if someone's having intrusive thoughts or having thoughts of wanting to hurt themselves or hurt the baby. Being able to do a really thorough screen there and safety plan in that moment has been great. But it really, Kim, it's such a great point. Like intake sounds very clinical and scary. So maybe we need to say evaluation or assessment, or I'm open to other ideas. I don't know, because it's like it is an intake, but it's also just like, I think
intake for what, right? Like
right, like what's gonna happen? Do I get sucked into something afterwards? Or And so knowing that it is a conversation and knowing that, it's a learning opportunity, and that at the end, what mom walks away with are, the opportunities of here's what Mother Baby Intensive Outpatient offers, or here's, based on the risk assessment, here's some other opportunities for you. And I know that what I always appreciate, when I get to work with we have some of the women who are in the Mother Baby program have also come to our moms groups, and it's that more in-depth conversation that mom gets more intensive support, education, therapy, and so it's a great opportunity for her. And most women haven't had that experience. Most people haven't had that experience. And so knowing that, you really get to focus on yourself and what's going on with you right that moment. And in a way where you're focusing 3 times a week, if you choose to go into the program, that's a big deal. That's a level of self-care that's pretty high up there. And I think
Absolutely.
Taking that first step to have the conversation is also self-care. Like reaching out and acknowledging that I'm, looking for the next level of support, having the conversation, and then, being offered all these other opportunities. So grateful that we have it in the St. Louis area. Finally, is this the beginning of year 3 for the program?
Yes.
That's awesome.
Yeah, we're really lucky to have you guys in town.
I feel like it's flown by. Yeah, I just feel very, very blessed to have had the opportunity to be a part of creating this program, to be the therapist for the program, to work so closely with the doctors. Oh, that's the other piece we didn't even touch.
Yeah.
Anybody that's in the program, I mean, whether it's face-to-face or virtually, they're also going to get psychiatric oversight. So I'm working very, very closely with Dr. Hyrova and Dr. Graywall. Those are our 2 psychiatrists that oversee the program. And they reach out to moms weekly for medication management, to do their check-ins. And that's once weekly, but more is needed. If mom's struggling and needs more active, medication management or oversight, then the docs will do that more frequently. So being able to collaborate, not only with mom, but with the doctor, and it's been great. It's been really great.
Yeah, and it's not as easy to get multiple providers in the same place to serve mom. So often it's, if mom's lucky, she has a follow-up appointment with her OB, and if OB knows what they're doing, they refer to one provider, and it's just very piecemeal. But it's nice that, like, while they're under your care, they've got many different touch points, so that they're less likely to fall through, any cracks that are happening, right? So
right, absolutely. Well, and there's a lot of case management that happens too while mom's in the program. I kind of wear that hat as well. So making sure as we're getting closer to graduation that we're starting to talk about not only the importance of follow through and follow up care, but what that's going to look like. And so I really try very hard to try to refer moms to people I think that personalities are gonna match, different specialties, different areas of focus, given all the wonderful providers in the area. So rather than just handing them a list, hey, this is what your insurance says they'll cover, I try to pull from my personal provider list and try to match people up that way. Anyone can refer. Mom can refer, OB can refer, doc can refer. So
there's no like formal barrier or process that is an obstacle to getting moms into care. They can simply pick up the phone and tell whoever answers what's going on.
Right. Yeah. I mean, partner can call.
I'm sure happens.
Yeah. It's I think that we have a unique opportunity and obligation to support these mamas and and the families, and trying to connect with as many providers as possible to make that easy and accessible.
And so once mom graduates, you're talking about connecting to whatever it is that will work for her, a therapist that she can see regularly. She also has the option to stay, or does she have the option to stay working with the psychiatric folks she's been working with, or how does that work in terms of medication management when she leaves the program?
So oftentimes, not all the providers have their own individual practice. Many of them are integrated mercy physicians, and so they may round inpatient and then come over here outpatient. Dr. Graywall does have a private practice, and so oftentimes I can transition folks to see her or to continue to see her at an outpatient basis. But what happens more often than not is they're reconnecting with their OBs.
Okay.
To continue that medication, unless they are more complex or multiple medications, then I'm going to send them to Dr. McKean. I'm going to try anyway.
But that's something that you guys are planning towards as you approach graduation.
Oh, so. Absolutely. And I will work very, very hard to try to establish those appointments prior to graduation. Because I just feel like we kind of set them up for failure for just, here expecting them to do it all on their own. They've just gone from 3 days of really intensive support to step down to, I don't have that anymore. So now I'm already kind of anxious about what am I going to do to fill that time. I've really connected with all these women in the group and the support. I don't have that, or it's going to look and feel different. So I feel like that's a lot to put on them. And so I really try to establish those things prior. Now that's not always a possibility. But we want at least those initial connections to have been made, where I've provided. Yeah. Right.
And you have the connections to the resources in our local community in St. Louis to make that happen, yes. Any kind of obstacles withstanding. But I think that's important to know as well, is that you can keep all your doctors, but then you also are under the care of in-house providers, and that's just for their convenience. It's not they don't have to switch their whole care team.
Not at all. And they don't have to be a mercy patient either, which I think is important. I've got, I have a mama right now who came in. She has a psychiatrist. She has an individual therapist that she's worked with for years. She's getting ready to start marriage counseling as well. And she said, this is my team. And I said, and they're going to remain your team. We might ask to put them on pause, or at least a psychiatrist anyway, while you're in the program. Our docs will provide oversight, but they're not going to make any changes without your consent, obviously. The mom that I have now that I'm thinking of, she, many will hold off on individual therapy while they're involved in IOP, just because it's a lot. I mean, how much therapy is too much therapy? I don't know, but that feels like a lot. But this particular mama, she sees her individual therapist on days that we don't have group. She has a session with her psychiatrist once a month on a day that she's not being seen by ours. And so she's maintaining those supports, and we'll follow up with them when she's discharged. So that's been nice. But we've got people from all over the place in different healthcare systems. And so does not need to be a mercy patient at all.
Okay.
I'm wondering if we can talk a little bit about the three of us just kind of wondering, because we know that, we're seeing this interesting kind of leveling off of women seeking support at the moment. We know that it's happening, but maybe not as much as many as we thought, or at the very beginning. And I'm just wondering what, you all think about that. And as a way, if there's a mom listening, who's wondering about support and holding it all together. And this is what I suspect. So I'm just going to throw out there. I suspect that what's happening is that, there's a level of struggle occurring where women are just kind of in survive mode. I just have to get through this.
Like day to day.
Yeah. Almost like, women and families who have a baby who's in the NICU, where you're just head down, figuring stuff out. You don't have time to check in, see how am I doing at this point, because you've got to get through it. And so I'm wondering if that's what's some of what's happening, and then so I'm interested in your thoughts on what you think might be going on. And then what can we, what is our encouragement for moms? Whatever it is that's going on that might be holding her back from seeking support.
I think you hit the nail on the head, Kim, and at the risk of too much disclosure, I was that NICU mama, and yeah, and so I very clearly remember one foot in front of the other when I was in crisis, right? Like, didn't have time to think about it. People would say, I don't know how you're doing it. I'm like, I don't either. You just do it. You just do it.
Doing what? I'm just like, waking up and like,
this is just what I have to do. And it wasn't until said crisis was averted, Darren came home. And that's kind of when
your body and brain knows
my brain like gave me permission to fall apart, right?
Yes,
like, okay, we're kind of in the clear. Now you can lose your mind. And so I think I agree with you. I think that's a lot of what is happening. And I also, even though we're virtual, I still, the hospital, the census is plummeted. Like, no one's going. No one is seeking services for anything.
Right.
And I think it's important to talk about, because I think that like the general public knows that like people can't have, so-called elective surgeries, even though sometimes those surgeries are for like really important things, like cancer treatment or whatever. But like, I don't know that the general public, like the non-provider public, knows that crisis lines, therapists, helpers, that we're getting fewer calls. And it's not because the need is being reduced. We know the need is there. The need is higher than it's been. So I think that's an important phenomenon to just be explicit about, because if I wasn't in a helping profession and recognize that people aren't reaching out as much as they typically would, I would just assume that like, oh, you guys are probably turning folks away. There's not enough help to go around. That's not happening. It's an interesting thing. And so one wonders, it makes sense, especially given that I'm a trauma therapist and I have this trauma perspective, like we're in the trauma.
Yeah.
And it's unknown when this trauma will end. There's no definite end to what that even means. And everyone's having traumas in this larger trauma of quarantine. Everyone's having their own traumas of this life that's happening. So it begs the question, like, is there going to be, is the well going to break, and when is that going to happen? And can we do anything to prevent it? I'm asking all the big, heavy questions that stress me out to think about, but like, that's what's going through our heads, right? Is it like, where are the moms? We want them to be calling and accessing help. And I don't think anyone's being proprietary or it's like,
call anybody.
Call someone and we'll get you to the right person. If you're not right for Sage Treat or Mercy IOP or, JAMA or whatever it is, like we'll get you to the right place. But it's just really interesting that I don't think people know that people aren't calling.
Yeah.
It's a little scary. I think about how we're going to keep up with the need moving forward, especially being the only person here, and with this level of care. And that's not to say that everyone's going to need this level of care, but I certainly want to be able to meet the need when it does present. And so
there could definitely be two of each of us.
Yeah, right. And like more than ever now, like we gotta hold each other up.
Yeah, that can feel like a lot of weight on your shoulders as a provider.
And so I'm wondering, like, as we wonder, I'm also wondering, like, what would feel encouraging to moms to let them know that they could, reach out now, even if they're feeling like, well, I can't invest the time right now to do this thing for me, whether that is, even if they do need an intensive outpatient program virtually, if they do need one-on-one therapy, if they do need some support, like what is, something that we could encourage them to do? Because sometimes I wonder if we need a little permission to, as a mom, if someone had said to me, you deserve some support. And I know that maybe you can't jump in with both feet today, but you could start here. You could have a conversation. And that means they could call and talk with Erin, get their intake done. Doesn't mean you have to start tomorrow, but you could learn about what the opportunities are. Sage 3 has their assessment program as well.
We're going to do the same thing. We're going to refer to any and all services that you're eligible for.
Yeah. And the Mom's Line, we do something similar. We listen and we'll help you get connected to peer support if that feels right. And then we'll also, connect you to other levels of care depending on what feels right. Or you can just simply call and have the conversation, and it doesn't have to lead to any next steps if that's not what feels right now. And so that's all I can think of to say, because I'm just wondering, like, for the moms that are out there, like, holding it together. And as when I get to spend time, because even our NICU, we have a weekly NICU parent cafe that's on hold right now because of social distancing, and we're figuring out how to make that go virtual. But I do know that even for those few minutes when we've got parents together and we can say, hey, we see you, we just want to remind you that it's okay to have feelings about all of this. Even if you can't be with them all the time, you could have them for a few minutes here, and that's okay. Or a few minutes in your bathroom with the door closed if you need that break, or 5 minutes outside on your back porch. That it doesn't have to be a 3-hour intensive program, but that's available, and,
it makes me think of like no commitment conversations or no commitment connections. And, we want to connect with folks instead of detaching or withdrawing or isolating. Now, that's not the same as like me time and making me time sacred. But if we find ourselves isolating or withdrawing or spending too much alone time, I'm always encouraging my clients to be connecting with someone, something. I don't care if it's your girlfriend, I don't care who it is. It doesn't have to be a professional, but just be connecting to someone, something. And maybe with that attitude or belief that like, it's no commitment. Like you don't have to call Mercy and then you're signing on the dotted line. Like, just be connecting. We have permission as moms, especially during this time, to be connecting.
Well, and I really like what you said, Kim, about just, giving the moms permission, giving ourselves permission. It's okay to not be okay.
Yeah,
right.
Absolutely.
And
it's normal to not be okay right now.
Yeah.
That's normal.
And I think that is huge. I have talked to countless women who they weren't sure about this program, or they heard about it but didn't really know the details. Once they found out it was group, they were like, nope.
That can feel really intimidating to some folks.
Yeah, we've had hour, 2 hour, 3 hour long conversations, and they left here, weren't committed to anything, had the resources and access to resources that they needed if they decided to go that route. And I received an email the next day, you know what, Erin, just you holding space for me was what I needed. I just felt seen. No one had ever, I had never felt seen in that capacity. And that was what I needed. And that was enough in that moment. And so, yes, I think we are all here to do that.
You're an empathy clinician, and it's so important. That's what she was feeling, it was that empathy. Well, I've put on comments to this live of how to contact Erin at Mercy. I should know the Mom's Line by heart, but I just don't yet.
It's 314-768-MOMS. And so, and that MOMS is 6667. So 314-768-6667.
Okay, awesome. I'm going to add that to the live as well.
And I think, Erin, just that, that you're holding space. And then Elizabeth said, empathy clinician. And
I changed my title.
I know, exactly. I'm like, I want to be one too. And so, but I think that that is key, that we're all offering this opportunity to have a conversation, and the conversation is powerful. I too hear that from women who are like, I just, no one ever listened, held the space for, got my situation in this way. And, I got off the phone and, I don't think I need anything else. I really just needed to be heard. And that's what we get to do, is we get to be there, and, be a space where women can be heard. And if they then need connection to other levels of support, they can, but they also are welcome to have the conversation. And so, which I think is an amazing place to start. It takes a lot of courage. You have to block out time to have a conversation. I realized during quarantine that has got to be hard. I cannot imagine having little children at this point, and what it might take for a mom to make a phone call. And so,
have the time to make a phone call.
Yeah. And because even with partners' homes, sometimes that's a support, but also it's often the partner's working from home. So it's not like there's extra hands. There's all different levels of complication, and we all understand that. Well, thanks for being with us today, Erin.
Thanks for having me. You guys are great.
We're gonna wrap up and hop off. Is there any final things you want to share with us, or anything we've forgotten? I know I have a question that it just occurred to me, but I don't want to, if there's something you wanted to share with us, Erin, before we step off.
When we first started virtual, I came across an article about the pressure to be productive. Yeah. And I shared that with the group, and the powerful discussion that came as a result of, like, we don't know how to just be, and because we're doers, we're workers, and we go, and but the pressure to be productive, even in quarantine, and just how real that is, but then giving ourselves an opportunity to redefine what productivity looks like, I think, feels really important as part of that conversation. Giving ourselves permission to just be, to just sit with the difficult feelings, to move through that, to get to the other side, to just rest our brains. And
like we're doing a lot. We just, it's hard to quantify it right now.
And so to your point, Kim, I have to wonder, is some of that interfering with moms reaching out? There's so much other stuff going on, or that they believe they should be participating in rather than investing in themselves. And so, I'd like to help take that pressure away if possible.
And sometimes I think it's just that, the day-to-day exhaustion of this time, even when it feels like, but I didn't get anything done. It's just the that pressure that we're all living under, kind of waiting for whatever's next. And so I think there's many factors, but like you said, if we can be a part of, holding the space for someone to get a break for a few minutes, then give us a call. And so, and we'll hold the space for whatever few minutes you have. And I know that, getting through an intake to get to the next level of care is key. But I also often, mom will call, she doesn't realize that there's an intake part of, because there's an intake part of my process too, non-clinical, but there's an intake. And so sometimes it's like, well, we have the conversation and then another day we'll have the intake. Like however that needs to work for her, because time is, especially right now, is so different, feels so different. I know time is still marching on as it always has, feels different. Well, I want to be mindful of the time. We have a few minutes left, and I'm so grateful that we got to learn more about the Mother Baby Intensive Outpatient Program today, and how it works and what happens when women graduate. And we've got the phone number. Elizabeth's been putting phone numbers in our comments, or they will be in the comments under this any final anything, Elizabeth or Erin, before we wrap up?
I also put a link to the invite for our Help the Helpers consult groups that happen every other Thursday that we're not doing Facebook Lives. So we alternate. So next Thursday, we'll be doing a Help the Helpers, and I put a link on there. You can click on the link and it'll take you to all the calendared Help the Helpers, and you can pick and choose which ones you want to attend. And then Zoom will give you info on how to participate. And those are intended for any type of healthcare, mental health care provider that's working with moms, or just anybody that needs to consult about like their caseload, how they're doing, how quarantine has changed, how they do business, how we're doing personally. And it's a confidential, we don't record it. It's a private Zoom, Facebook group for us to consult on what's going on personally and professionally. So that's happening on alternating Thursday. So that link is also provided in the comments.
And when you're mentioning the provider side of this, I do want to acknowledge both of you for being so open and willing to consult with other providers. So I know we've been talking a lot about moms. I think it's really important to know that, you know, Elizabeth and Erin, you can reach out to them and consult and ask questions. And I so appreciate that, you know, you're both always available for that. I don't mean like 24/7. However, you've been very available.
I like that.
Yeah.
So if anybody listening has a tricky client or isn't sure how to respond to a mom, or just needs to like vent, that's a valid need. You have needs too, just like your clients. And I personally, I'm good about setting boundaries. So if I can't, or I don't want to, or whatever, I would say, you know, I would say so. So nobody's making me debrief.
I'm not gonna lie, I got individual therapy last week. It was fantastic. It was fantastic.
And the helpers. It's really helpful for providers to be able to talk to different providers. So take us up on this free consultation. We want to talk to you guys.
And I know for me, when I've been working with a mom and she needs other levels of care, and I might need to, and she's looking at getting into maybe going to an emergency department, and I have appreciated being able to call Erin and talk a little bit about access to the Mercy emergency department, and, you know, will the IOP program follow her, and I've really appreciated that you've made yourself available to help mamas get, not that we're helping them get into the ER, they have to go there, present themselves, but once they get there, to know that, you know, someone from the Mother Baby program is watching out for them. And so really appreciate that. Absolutely.
You know, none of us were meant to do any of this alone. And so just try to support everybody however we can, whatever they need.
Well, thanks for being with us today, Erin.
Thanks, everybody.
We'll look forward to seeing you in one of our provider helper, I always say it wrong, Help the Helpers chats, as well as on a Facebook Live, maybe in a little bit, to see how things are changing and maybe what's new. All right. Well, thanks everybody.
Thanks, everybody.
Have a great day.
You too. Stay safe.
Take care. Reach out, connect. Bye.